Sir, we are live now with all your permission, sir. I am starting this webinar for today.
Okay.
Okay, sir. Good afternoon, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's webinar. Let's welcome today's speaker with great honor, none other than Dr. Suchit Tamboli, sir. And let me share some of the achievement of sir. Sir has done PhD in Development Pediatrics, FIAP, MBBS, DCH, PGDAP, PGDMLS, and Consultant Developmental and Behavior Pediatrician at Chiranjeev Clinic, founder and director of First Child Development Center in Maharashtra since 1992. So he is going to speak on a very important topic, that is ASD in low resource setting, challenges and strategies for early detection and intervention. So to know more about this topic, I would like to invite sir and hand over this session to sir.
Thank you.
You can continue.
Yes. Thank you. At the outset, I must thank IJCP for giving this opportunity for this different topic than regular ASD topic. So actually, but for that, we should know what is autism. What autism is developmental disorder, which is characterized by qualitative impairment in reciprocal social interaction and social communication. And there is restrictive, repetitive, and stereotype pattern of behavior, interest, and activities. And they may have unusual responses to sensory experiences or perception. So all these three characteristics are very important and they should be there. So why autism is important nowadays? Because there is 1% of world population is suffering from autism, and male to female ratio is 8 is to 1 or up to 2 is to 1. In India, it has been estimated that more than 2 million people might be affected by ASD. And prevalence rate for autism in children from 1 to 10 years is found to be 1.5%. The prevalence has doubled in last decade. It is very unique because an apparently normal looking child with so many abilities and skills is not functioning in a social setting. And when assessed on a developmental scale, they show total lack of uniformity in different areas of development. So we assess the children below 6 years on 6 areas like gross motor, fine motor, then mental development, social development, expressive language, and receptive language. So all these 6 areas should be assessed of all children below 6 years. So the children have to be diagnosed on the basis of clinical suspicion, and then they are assessed by using autism specific scale. So what are the challenges? Actually, most important part is that ASD affects all races and ethnics, but difference exists in prevalence rate at the global, national, and regional level for the several reasons. Early diagnosis is essential for providing early intervention, and increasing evidence shows that early intervention is associated with the better outcome. So that's why early diagnosis is necessary so that we can give early intervention to the children. So recently there has been a paradigm shift of research focus from behavioral intervention to biological aspect, including genetics, neuroimaging, biomarkers, molecular research, immunological dysfunction, and novel pharmaceuticals drugs which are used. So systemic review of studies on dietary intervention shows no high quality evidence of efficacy, but there are changes claimed by the researcher regarding the dietary intervention. Current reviews of studies on novel pharmacotherapeutics like intravenous secretin or chelation therapy, they raise concern regarding potential risk over the expected benefit. So need remains for interventional research across setting with the continued improvement in the methodology to enhance our understanding of its efficacy and feasibility. And it is very important that all these strong understanding issues help in developing culturally relevant and low cost program. So developing interventions deliverable at primary care level and involving parents in the treatment of process can lead to better outcome. So this is very important sentence, that when you involve the parents, the outcome is better. So you have to involve the parents from the day one of diagnosis. So evidence-based approaches include developmental therapy, behavioral therapy, educational intervention by professionals or parents. Then pharmacological therapies are used as adjuvants to treat several problem behavior as needed. And the pediatrician to discourage parents from spending resources on the therapies with no based benefit. So like acupuncture and all, they don't have any evidence base for the management. That's why you should not advise that. So it is very important that you should advise the therapies which are having some evidence base in them, and they are the research has been done in the community. So pediatrician can also provide anticipatory suggestion and help parents access proper resources for the managing their children. So strategies to provide education at every level of healthcare system, that is from the Anganwadi workers till pediatrician level, you have to educate everyone, and from medical providers to professional and paraprofessional also who engage with children, their families. So in addition, they point to the need for the team-based strategies, private-public partnership, and international collaboration that will reduce the need to reinvent the wheel while advancing care for children, families, and society at large. So some of the challenges to early diagnosis are lack of available culturally appropriate tools that are scientifically valid, and the prohibitive cost which is associated with the use of gold standard tool. Then the list of screening and diagnostic tool, as well as practical approach to improve early diagnosis of ASD in low and middle resource communities. So simplifying and demystifying ASD at a local community level is critical for the advancement that are needed, but this must occur in concert with the improvement in educating. So what is the aim of autism? So rather than labeling, we should concentrate on enabling them. And diagnostic to multidisciplinary early intervention is very important. So what are the protective and risk factors which are linked to autism? So presence of healthy, prosperous, and caring home environment for a lady during pregnancy soothingly influences a child's personality. Then compromised immune system, mitochondrial dysfunction, intellectual disability, prenatal, perinatal, postnatal factors, adverse environment, gynecological interventions, and defective genes. These are the risk factors for the autism. So genetics actually here ASD is multifactorial, multi-pathway genetic disorder that doesn't obey classic Mendelian inheritance. Then actually adverse environment, which is again very important factor, where cumulative neurotoxin exposure during sensitive period of pregnancy disturbs the neuronal circuit formation and causes disorganization of different parts of the fetal brain, consequently leading to mental retardation and abnormal behavior in the child. So here we should know that actually exposure to certain substances like alcohol, mercury, lead, that can produce autism in children. But even it is linked to the increased incidence of autism, like short interpregnancy spacing, abnormal gestational age, multiple pregnancy, gestational diabetes. So they are also risk factors which can cause autism. Perinatal stress is also very important, like fetal growth restriction, IUGR, or preeclampsia, or umbilical cord complications, chorioamnitis, or acute intrapartum hemorrhage. So such also causes are important. They can cause autism, or they can contribute to the autism. Then gynecological complications like artificial insemination, advanced parental age, then cesarean section. So they also are linked to development of autism. So how to suspect? Because early intervention, early diagnosis is very important. So if the child does not babble by 1 year of age, does not point to object or people by 1 year of age, does not make meaningful gesture by 1 year of age, does not speak one word by 16 months, does not combine two words by 2 years, then speech not understandable by 24 months, does not respond to name, loss of language or social skill. This is very interesting that मदर विल टेल यू दैट 1.5 साल तक तो बोलता था, फिर बाद में उसने बोलना बंद कर दिया. That is very common. So does not respond to name, loss of language or social skill at any age, and decreased use of non-verbal behavior during communication, like eye to eye gaze or facial expression, body postures or gesture. So what are the signs which are which will lead you to suspect autism? Poor eye contact, does not smile in reciprocation, does not seem to know how to play with the toys. They are more interested in things than the toys, like kitchenware and all. They take that more than the toys. Excessively line up the toys or other objects. It is attached to one particular part of the toy or object. Absence of joint attention, does not share enjoyment, interest, or achievement with the other people. And while assessing autism, what we have to do? First, medical assessment, then developmental assessment, assessment of ASD by CARS or DSM-5, assessment of functioning of child, like strengths and difficulties. This is again very important because we have to assess their strengths and difficulties. This is very important according to the WHO and UNICEF, that now you have to assess the strengths and assess the difficulties, and actually that difficulties should be solved by giving training with the stimulation programs as well as therapies like occupational therapy. So diagnosis, it's a clinical diagnosis, always. And children have to meet certain criteria, which are based on developmental and behavioral characteristics. So before we can give them diagnosis of ASD, there is no specific investigation for the ASD. And investigation should be directed towards the associated medical disorder, which is based on clinical suspicion. So 10 to 40% of ASD have an identifiable medical disorder. Remaining cases of autism, there is no identifiable cause or it is idiopathic. So inheritance is likely multifactorial with strong genetic component, and current research evidence available gives families in, empirical recurrence risk only. So there is no prenatal or carrier state diagnostic test. So severity can be assessed by level 3 is requiring very substantial support, 2 is requiring substantial, and 1 is requiring support. So according to that, we have to give them prognosis, which is again very important. So then investigation may be other investigations like BERA or EEG, MRI brain. So these are useful in case of differential diagnosis, like autism with epilepsy, autism with developmental delay, autism with dysmorphism or short stature or obesity. Then you should go for genetic study or T3, T4, TSH, that is thyroid function test. And autism with irritability, pallor, recurrent infection, iron, B12 or vitamin D, all these are important. Then what is the role of developmental assessment? The diagnosis of autism is clinical. So 2 steps. First, screening with MCHAT, because that is ideally from for 18 to 36 months. Detailed neurodevelopmental assessment. Then detailed history. Uh, then INCLIN, DSM-5, ADOS, CARS, GARS. All these are the tests which are specific for the autism. Then developmental milestone assessment, like ASQ. Then sensory profile, diet recall, behavioral history, and sleep history. All these are important. So then role of pediatrician. Pediatrician should build trust, empathize the emotion from unable to label, home training, that is basic interventional strategies, which are very important, counseling to avoid medical shopping and be available for them so that they can ask any questions. So focus on comorbid medical conditions, such as diagnosis as well as comorbid condition, neurological condition, diet, deficiencies, general health, role of medication, immunization, regular follow-up. Then comorbid conditions like neurobehavioral or GI condition like constipation, GRD, neurological condition like epilepsy or seizure, neuropsychiatric condition like ADHD, anxiety, depression or bipolar disorder, sleep disorder or sleeping challenge. So multiple reasons for the multiple therapies. Actually, it is very important that no one therapy solution is proved completely effective. And that's why these children require multiple therapies. So autism affects multiple areas because it affects communication, it affects sensory integration, then it affects behavior, it affects ADL. So combination therapies give better result. Most combination therapies suggested are applied behavioral analysis, special education, sensory integration therapy plus OT, speech and language therapy. So you have to customize all these therapies according to the age, speech develop, cognitive level, and behavior of the child. So to start as early as possible, home training whenever required. Remember, OT is not answer to all. So only OT is not answer. You have to give all other medication as well as therapy. So combination approach is important and feasible or economical and relevant. All these are again very important. So parents need guidance. Nature of therapy changes with the age. Play therapy or behavioral therapy and social skills are integral part of the program. Therapies need to be integrated with learning program and lifelong support is needed for these children. So when child grows to adolescent, what happens that there are behavioral issues, basic life skills problem are there, demands on teens increases dramatically because of school, at home, and social settings, or all they demand some things from them. Preparing for the puberty, grooming and personal hygiene, finding a place in the social world, and understanding gender, relationship development, all these are important while growing into adulthood. So life skill training should be given. So here life skill training is parent mediated and hence require training of the parents. So inclusive school and teacher training is also very, very important. So life skills training is mostly at home, in school or in various social settings. So child strengths and interests, known to have specific strengths and interests, so useful or not useful, how to give constructive direction and can be developed into vocation. So is it barrier for all overall development and special coaching and coaches are required. So you have to increase their strengths and minimize their weaknesses. So that is the important story of developing strengths and interests. So role of parents in early intervention, you should diagnose as early as 2 years or 2.5 years. And early intervention, individualized support is very important. Daily life skills, you have to work on that because there are few patients you will come across that they even know the daily life skills. So they are not doing, not passing urine properly or not passing stool properly. So you have to work on everything. The challenges faced by the parents actually empowering parents through requisite knowledge, promoting emotional well-being, shaping future advocate, alternative education approach like range of option like inclusive schooling, special school, homeschooling, unschooling, all depends upon the parental attitude and resource. And as the age advances, shift from one type of education to another is needed. So what are the long-term goal? Independent living, well adjusted in society, communication skill, appropriate for level, vocational skill, making the child useful for the society. So happy child and happy family is very important. Then the socialization, eye contact, facial expression, joint attention, desire or initiation of the social contact relating to people, then understanding or expression of emotion and exposure and encouragement. So all these are important. Then support system are the biggest challenge for the children with autism and their parents. Support is required everywhere in the school in the form of shadow teacher, in the home as a form of trained house help. So transport trained people aware of meltdown in autism and technology for communication as well as safety is important. So daily routine and stress, structure, environment and schedule is very important. You can give pictorial instructions as well as prepare for them for changes. So daily routine and stress is very common. Predict and deal with it. Sensory sensitivity and behavioral approach is important. Attention seeking behavior, tangible behavior, it is always there. So you have to actually give treatment like whenever you want to give something, you give it immediately. If you don't want to give, just say no. And actually, even when one says no, the other people also in the house will say no and ignore them when they are doing tangible behavior. And whenever they becomes normal, you just talk to them normally. So medication, there is no cure medication. This is very important sentence. So challenging behavior may require medicinal report like FDA recommends only two medicine like risperidone and aripiprazole. So both drugs require supervision. Then brain tonics are there like omega-3, L-carnosine, iron, magnesium, B12. So all these they are given, but they have not proved role. Gut-brain axis probiotic in selected cases. GFCF diet, which has limited use, but it can be used. We have seen few of our patients' hyperactivity has definitely decreased due to GFCF diet. Then vocational guidance is very important. As early as possible, you have to start rehabilitation, skill-based training and program. Only focus on academics, self-help skill, life skill, basic academics, and health or sex education. Then anxiety and behavioral problems should be solved with the CBT. Then actually, whenever that child is transition is into adulthood, there is education, career, taking care of routine, taking care of home, and managing money, finding jobs. So all these are important problems which they have to face. So prognosis depends upon the severity of ASD symptoms, pattern of onset and clinical course, cognitive abilities, associated condition. So what is important is early diagnosis and need of substantial support. So what are the challenges? There is huge scope for the better coordination between healthcare system as well as service providers and the special training school available for disabled ASD children. The pathogenesis of autism has oscillated from sole uterine factors, singular environmental approach through the solitary genetic approach to uterine gene environment interplay of the modern times. Then focusing on consolidating the protective factors like antepartum and postpartum might prove to be effective method for the prevention of ASD. The wise selection of diet during antepartum and postpartum phase can help to reduce the challenges of ASD associated with neurocognitive impairment. Then assurance and reassurance given to the child are essential component of counseling. An integrative approach combining drug therapy and non-drug therapy aimed at ameliorating the primary and secondary symptoms of ASD and is more likely to help the unfortunate child and improve the quality of life of the concerned family. So the challenges, future challenges include better understanding of influence of gender and the better application of what we know about dimensions that significantly impact the life of pregnant ladies and ASD patients in different countries, cultures and population. And furthermore, management strategies based on autistic voices and inputs from the adolescents suffering from autism and their families would surely go a long way in improving the quality of life of the ASD community. So to summarize, primary physician or teachers usually suspect it first. Impairment in social interaction and communication with restrictive repetitive pattern of activity and behavior. It's a clinical diagnosis, so investigation have limited role. Use MCHAT screening. Earlier you intervene, better is the outcome. Refer early. Labeling to enabling is important. DSM-5 is current standard for diagnosis, and diagnosis is important, but what next includes enabling the child, which is very important. So thank you very much for giving the opportunity. For us, are there any questions?
Thank you so much, sir, for taking out your precious time and sharing your knowledge on this topic, sir. I definitely think this session knowledge is going to help all the participants on their practice also. Sir, we have received some questions, sir. With all your permission, shall we take these questions?
Yes, yes.
The first question is related to autism. This question is from Dr. Subramaniam. He's asking, like, being a physician, what will be the first approach towards the autism patient and how to check that they are into the autism and what are the clinical examination we need to refer?
Yeah. I think I have already told what are the red flag signs like delayed speech or when the child is not giving eye-to-eye contact or socialization is affected. So all these are very important factors. which should be alarm that physician that this child may have autism. So then if if you are suspecting autism, then what you have to do is to go for the detailed testing. And for, with the developmental neurologist or developmental pediatrician, you can get all tests done. And if you do the developmental testing of that child, particular child, and diagnose that as autism as early as possible, then you have to give intervention. So what intervention? Intervention in the form of occupational therapy, speech therapy, stimulation program. So all these are important, and it can be given in a proper manner and proper way, so that the parents can understand that.
Thank you so much for answering this question, sir. Moving forward, another question is from Dr. Singhania, and he is asking, sir, like once we know that the patient is child is suffering from autism, like what are the things we need to motivate the to the parents? What are the things we need to convey, and what is the role of in this in the treatment, sir, of the parents and the society?
Here the most important part is not only autism, but you have to assess in all 6 areas. And actually, you have to diagnose that whether that child is having autism with mental retardation. Child is having what is their DQ? Like if the child is having normal mental development with autism, or child is having higher IQ with high autism. So like Asperger syndrome. So where the child stand is important. So according to that, you have to start with the form of treatment in the behavioral therapy, as well as then medicinal treatment, or you have to give follow up for the stimulation program, as well as occupational therapy. So this is very important that they should give the therapies which are required according to their mental age, and then observe them every monthly, and every 3 monthly they can do the DQ, or every 1 year also they can get the DQ done.
Thank you so much, sir, for answering. One feedback from Dr. Anshuman. He has written very important topic, and thanks for coming with the discussion. And
Thank
I hope, sir, they all have really enjoyed this session, sir. As I can see, there is no more further question. I hope you have done justice to this session, sir. And sir, like if there is no more question, with all your permission, shall we conclude this session for today?
Yes, thank you very much.
And welcome, sir. And we would like to see you in future also with different topics, sir. Till then, take care of yourself, sir. It was really great honor to have you on our platform, sir. Thank
Thank you
you.
very much. Thank you.